Go ahead.
Hi, my name is Hope. This has been a little over 2 weeks after my total thyroidectomy. This has been an interesting journey, and I'm here to basically show you where I'm at right now and to tell you that today is my first day back to work, and I did really, really well. It's still kind of tired and run down. Probably the worst part of everything is just being tired. And you don't really get over that. Your body just learns to heal and recover with each time. I think the anesthesia was the hardest second part for me. The day of surgery, I did get very sick multiple times. It's no matter, I didn't eat. I even did plenty of precautions to make sure, but it still happened. And then when I did the week follow-up with my endocrinologist, he changed my medication. The surgeon put me on levofloxacin. I'm probably pronouncing that wrong, but the doctor himself put me on the brand name Thyroid because he wanted me on that in particular. And I will be doing a 5-week blood check and then a 6-week check with him, check the levels, my thyroid levels. And we will be doing a video about that later on as this little journey continues in that sense. But this is just showing you my scar update. It's actually scarring pretty well, but he used very tiny little stitches, and he actually took them out about 4 days after surgery. That's Thursday, Friday, Saturday, Sunday, about 5 days after surgery, and then did sterile strips, and it healed and recovered very nicely. I'm very pleased with it. It's not sore, it doesn't really hurt. It's a little tender still, but for the most part, it's doing really, really well. And I just want to take and just express my journey and how I'm handling and doing everything, and that it's been pretty remarkable. My voice has been amazing through everything, slight hoarseness here or there, but for the most part, really good. And I was able to eat and do pretty well with everything. It was the size of an egg, so it was pretty huge. This right lobe was. The left lobe had just a few smaller nodules, but it still was growing rapidly, so it all had to be taken out. So it was a total thyroidectomy. I'm on a lot of little groups right now to try to recover from this and make it through. But basically, I want to try to share with you this video because if you keep watching, you'll see from the very beginning of when I arrived at the hospital and just how big it looked until this video and this moment right up until now. So please enjoy this, and please know that I will be doing multiple follow-ups to see how I handle with the medication and so on. So, and if you have any questions and stuff and everything, you're more than welcome to leave comments, because I would love to answer any questions anybody has, because I'm still learning myself. And I did this to help anybody going through this, because I've seen videos and none of them are recent and none of them tell you the things you need to know. Probably one of the other things is the sleeping is a difficult thing. For those first 3 or 4 nights, it's next to impossible to get comfortable, but it does get better eventually. So basically that's about it, and just continue to watch and see how this journey begins. Thank you.
Yeah, so stay tuned. What we're going to do is we're going to edit this video together with everything that pretty much from the very first day that we got to the hospital, and we kind of did little interviews with Hope like every couple of days during the journey, even like the hour she got out of the hospital and everything. So we're kind of at the end here, kind of introducing you to the beginning. So stay tuned. And I know Hope's really anxious to get this video out and start answering questions and really communicating with people and talking and sharing her experience and everybody else's experience. So it's really looking good here. And believe it or not, you know, that's with her head back when she's just regular conversation, and they followed a nice little line in her skin there, and it's really healing wonderful there. So good morning, babe.
Good morning.
The morning of the surgery.
A total thyroidectomy.
And oh, you can really see it. Big lump here. This side's small, you really can't see it. And then bend your head down, babe. They'll try to use one of those lines right there. Well, higher than that, way higher. Higher, right there, yeah, probably. And get that out. Well, I love you, babe.
I love you too.
We'll see you afterwards, see how you feel. It looks. You want everybody to hear your voice right now?
It's really weak.
Alrighty. Well, this is for you to see. Nothing to see.
Right down right now. But for the most part, I think I'm doing okay.
Cottonmouth going away.
It's gonna take a little while. It just
feels like I'm not able to talk real well.
Your voice sounds okay though.
I'm thankful for that.
Yeah, I don't think there's any difference in your voice.
That's a plus.
Yep.
I just wish the cotton mouth is the worst part right now.
Well, it's only been an hour since you got out of that surgery, so.
But I'm able to swallow pretty good. So that's a plus.
Yep, and clear your throat.
Yeah. So those are a good sign, right?
Yep.
How big does it look?
It looks tiny.
Awesome.
Yeah.
Awesome.
2 hours.
It's been 2 hours after surgery. Very weak, very tired, but all in all, good spirits. I figure once the anesthesia wears off, I'll be better. I can feel it. My voice isn't too bad. A little wispy, but not bad. Just very cotton mouthed, but I'm getting better and better. So surprisingly, it's not as bad as I thought. More updates to come. So thank you, everybody.
It's 8:45, same day of surgery. Moving around a little bit. Did get nauseated about 4 times. I think it's due to the anesthesia. Having a hard time keeping stuff down, but I'm working on it. The soreness is starting to come in. The sore spot is right in here, where I think they did some
a little bit lower. Oh yeah.
Where they did some sort of shot, or I don't know if it was like Jason said, a scopic thing, or a numbing shot, or what a tube would have been. I'm not 100% sure, but it does hurt really bad. I'm trying to move around right now because I've been in bed this whole time. I feel a little bit of movement wouldn't be bad, kind of help with swelling. I guess that's my only concern, is swelling and bleeding or infection. So I'm just doing what I can to keep it under control. So again, thank you everybody for all the well wishes. Another update will come tomorrow, because I know it's going to probably be a little bit worse tomorrow, but each day I do get a little better. So again, thank you everybody. Hi everybody. This is 24 hours after the surgery. The pain is there now. It's very tight, very sore, minimal movement. It hurts really bad. I can only sleep sitting up. My voice is wispy. If I try to talk any louder, it goes away completely. I haven't been able to eat anything all day yesterday. I just kept getting sick. So right now I'm going to try and eat and hope for the best. I'm trying to stay away from the pain medicine that they gave me, because it'll definitely make me very sick. So I'm just sticking with Tylenol and Advil for now. As you can tell, the bandage is still on. I'm not sure when I could take it off, but I'm dying to see what it looks like, honestly. So hopefully today or tomorrow we'll give you a video update of what it looks like. I haven't taken a shower yet because I think I could take one tonight. So we'll see how that goes too. Other than that, thank you everybody, and take care. Hi everyone. This is going on about almost 4 days, and took the bandage off today just to see what it was going to look like. Managed to wash my hair today with the help of Jason. Did some makeup. Tomorrow the stitches come out, but I just wanted to get a good look and get it some air just to see what I'm working with. As you can tell, this is what it is right now. Jason counted about 12 stitches, and it doesn't look bad at all, so I'm hoping this is going to be a good sign that it's going to heal over really well. I bought some anti-scarring stuff, so hopefully I'll be in good shape. I'm still tired, still a little sore. That's to be expected, but all in all, I'm trucking through it and doing pretty good. So thank you everybody.
I think this is a little irritation of the glue from the bandage right here. That's all this is. And I think this is actually a big dirty glue spot where it came off first. But we can't be wiping on it with anything. I don't want to risk anything dripping down on there. The doctor will clean you up good. Looks good, babe.
Hey everybody, it's been how many days?
4 days.
4 days since the surgery. Today we got the stitches out. they said I can go without the bandage now, and they put this sterile tape that they said will fall off on its own and just to naturally let it. I can't get it wet until tomorrow. And then when it falls off a day after, I can put Mederma on it to start to treat it for scarring and to help with scarring and healing. It doesn't hurt. I mean, it's sore, it hurts, but I mean, it's not like what I was expecting. I'm actually doing pretty well. My voice is, you know, good for the most part. It's just there's times where it's a little kind of like pitchy. I did find out today though, we asked the doctor about this bruising right here, and apparently it's from like wires and cords they use to help maintain your vocal cords so that there's no damage done, which might explain the little bit of a sore throat and why this is so sore right here. I did ask the doctor, as he verified it was actually bigger than an egg, the one he took out on the right side, so that's pretty big. I didn't have to, my parent glands weren't damaged, so I'm not on calcium pills. I haven't taken any pain medication. I've been maintaining it with Tylenol and Advil, which is really impressive. So all in all, I think my recovery is going pretty well. I'm not saying that everybody's would be good, but mine is actually doing pretty good, so I cannot complain, and thank you everybody.
So stay tuned for this journey, and we'll be making more videos in the future, you know, like follow up, and we'll see how this thing looks after a few months and if things change or any complications come up.
Thank you.